Hello and welcome to yet another episode of Glow. Glow stands for Genuine Loving Outstanding Women, and it's an initiative by the Heartfulness Institute to help women all over the world to become stronger and at the same time more loving and gentle, yet courageous versions of themselves. In today's Glow Heartfulness webinar, we have two eminent, qualified, amazing women who are going to talk about an important issue in the world, that is the COVID-19 pandemic. At the time of this recording of the webinar, we have about 150,000 deaths across the world and more than a million affected. It's a time of fear and anxiety, confusion and alarm, and a lot of negativity going around. In this hour of crisis and pandemonium, let us sit down together and chat, share some ideas and thoughts, tips and strategies to help cope up. Let us focus on some positives. Let us focus on the hope and try to do the best we can to ourselves to take care of our immediate family, our community, and if possible, for do something for the species, our humanity as a whole. Let me introduce our guest today. We have Mia Malan from South Africa. She founded the Becky Sisa Center for Health Journalism in South Africa in 2013. She's a media startup's editor-in-chief and executive director. Mia has 26 African Journalism Awards for her work. She serves on the board of directors of the Center of Science and Technology and Mass Communication in South Africa. And she serves as an advisory board member of the Women in Media Network of Grace Marshall Trust. Welcome, Mia. Thank you so much for being with us today.
Thank you.
The other guest which I have is Dr. Swati Kannan, who is a surgical general cosmetic dermatologist, and she is practicing in California. She specializes in Mohs skin cancer surgery and reconstruction. She mentors residents and talks frequently in many conferences and CMEs, continuing medical education conferences. She's a heartfulness trainer and incorporates a lot of meditative techniques as she mentors trainees, ensuring that they achieve inner stability and focus while pursuing their goals. Welcome, Swati. Thanks so much for being here today with us.
Thank you, Purnima. Thank you for having me. And Mia, thank you for, well, it's nice to meet you again on our webinar.
So the title of this webinar is Tale of Three Countries. It reminded us a little bit about Charles Dickens' Tale of Two Cities, and we wanted to keep the tone light because there is already so much of negativity going around. There is a lot of panic and anxiety and fear, as I mentioned. So let's have a lighter view at all of this, and let's also look at the realities of it. Let's begin with the first question to Dr. Swati Kannan. And Swati, can you share about COVID-19, this situation in the United States of America?
Of course. Well, the US is in the spotlight as we have the most number of COVID cases in the entire world. We are number one. I think there's about 2.2 million cases worldwide and over 700,000 cases in the US alone, with about 33,000 deaths in the US. The epicenter, I think, is New York, and New York just by itself has surpassed, the rest of the world in terms of each country's cases. I think just answering this question alone would be an hour-long webinar. So I'll do my best in kind of summarizing it. I'm in the state of California, and we were the first state to shut down, meaning to have a home-wide shelter in place. So we are staying at home if we are not essential workers. So I'm a healthcare employee, so therefore I'm essential. I do have to go to work. But for the rest of the people, they get to stay at home. They work from home. We can go for walks and we can go grocery shopping. We can go to the pharmacy. But outside of that, all the other businesses like restaurants, we can't sit inside restaurants, can't go to theaters, etc. So I think the US has been pretty difficult in terms of shutting everything down. It lags behind a lot of other wealthy countries when it comes to testing. We have only tested about 1% of our population, which is not enough. And out of that 1%, 1 out of 5 people are testing positive. So if we have a 20% positivity rate, that means there's a lot more people affected that are not being tested. We have noticed that there is a flattening of the curve. I think all of us have been talking about how to flatten the curve, and the best way to flatten it is to, socially distance. So now that we have flattened the curve for the last few days, I think the US has to monitor how the curve continues to be flattened before starting the phases of reopening the country. We're also at election season. So our presidential elections are coming up in November of 2020. And that has played a role as well in how the situation has been handled by the federal government. There's been discordance between the worldwide recommendations and our country's own recommendations. Initially, I think this COVID situation was not believed to be that big of a deal, and then the tone has changed since then. And we'll see how every day is a new situation. It's very fluid situation. So right now we're still in the shutdown process. States individually will decide when to open up their respective states. It is not a federal decision, which I think is very different from other countries. While we are a democracy, the power between the federal and the state governments are divided, so that no one authority has more power than the other. So while that's really great in good times, I think in these current times, the states look up to the federal government for leadership and to get support for ventilators. And that, has not always been happening. The states are also divided. A few of our states are still not shut down. They're still doing business as usual. So I think I have torn feelings. While I love, living in America, and there's lots of benefits to living here, I don't think the situation has been handled in the best possible way. Speaking of, I think, women and female leaders, if you look at the female-led countries like Taiwan, I believe like Finland, and a few other countries.
Germany.
Denmark, yeah. I think
Germany.
those countries Germany. Those countries are doing a lot better. There was a huge article on it, which I thought was really interesting to read. Those countries are doing a lot better when it comes to handling the situation. So anyways, I will leave it at that. But I think the summary of that is we have the most number of cases. We probably have a lot more people infected than we are currently testing. We need to ramp up our testing. We need more protective equipment. We're still kind of in the same, while we're better than we were a month ago, we still have we still have far ways to go.
Thank you, Dr. Swati. That was, in a nutshell, you shared what's happening in the US. Mia, I would like to hear from South Africa. How do you think South Africa is handling this situation?
Yeah, so in South Africa, we had our first case on the 5th of March. And within 2 weeks, we had a national shutdown. And our government structure is different than from the US. Here, when the president can really order the entire country to shut down, even though we have provinces. So our government responded in a very early and decisive way to the outbreak. We started our shutdown at a very early age, within 2 weeks after the first case, and we're now in the 3rd week of that shutdown, and we still have another 2 weeks to go. And it's a really strict shutdown. We are not only not allowed outside, we can only go and buy groceries and medicine. We're not allowed to take your dog for a walk or to exercise outside. And there's also a national ban on alcohol sales and on tobacco. So that has been, quite a contentious issue in the country. There has been attempted court cases for that, but the president is sticking to his point that we should not have alcohol during the lockdown, for which there's, of course, a lot of evidence why you shouldn't have it. And one of those things is, or two of those are like, South Africa is a country with a a very high use of binge drinking. And as a result, there's a lot of emergency cases for that. So they will be taking up beds of COVID-19 patients if we have too many injuries like that. And it will also make you less likely to practice social distancing, because when you have had alcohol, you're a little bit more relaxed, and you have less judgment, and you may not stick to all the rules, and that might lead to infection. Generally in the country, there's been a pretty positive reaction to the government. We've been quite proud of how they've handled it. We last week started with a very sort of intense testing campaign. We now have 20,000 workers going out across the country to really knock on people's doors and screen them. It's mainly in hotspots, it's not everywhere. And our data so far shows that our lockdown has had an effect on slowing down cases. There's been, at the moment, the past week, we had about 95 cases, new cases each day. Of course, those are just confirmed cases. As Swati has pointed out, it's obviously not all the cases. And we've got a very strong scientific committee that supports the president and to whom he really listens. He really does what they say, of which we're very proud, because we come from a background where we had another epidemic, HIV, where exactly the opposite happened. The government did not listen to scientists. They started with treatment very, very late in our HIV epidemic. And as a result, many people died unnecessarily. So in South Africa, I wouldn't say we're positive. It's tough, that the lockdown. And I think it's important to point out, because South Africa is such an unequal country. So the middle class is really a very small part of this country. It's like 15% of the country. 85% of this country is really, really poor. So there is different consequences for different parts of the population. There are some people in South Africa, and it's not just a few, it's quite a significant part, who are having no food and they are hungry. So there's a little bit of social unrest starting, because people are now at the stage where they feel, poor people, they cannot go any further because they don't have food. We've had incidents of people looting grocery stores, quite a few incidents of that, because they really don't have food. And while the government has promised to get food parcels to poorer areas, those parcels have not reached everywhere. In terms of our cases, I haven't told you those numbers. We around about 2,800 cases, and we've had 50 deaths.
Wow.
That's really impressive. Yeah.
Mia, that's amazing. Yeah, our cases started in January, actually, was our first case, which was the same week that South Korea's cases started. And we have beaten South Korea by a landslide, because now we have 700,000 cases. So, wow, that's amazing that South Africa's government's done such a great job.
Yeah, I'm proud of it. Yeah.
So in India, there was a lockdown which started when we had just 600 cases. And the deaths were just in a single digit number, or probably early double digit. I'll have to look that up. But like when we were talking about the democracies, I was just reminded that in India, the center had more power to issue a nationwide lockdown. And I think that was very instrumental in helping flatten the curve so far. So there has been ups and downs since that time, but so far it's probably for the good, because like we can go out of the homes for just basic supplies, and for, like you said, essential services. My husband is a physician, so like only he goes out, and we are all quarantined at home, or we are all locked down at home. And the government has also done its part by giving financial support to daily laborers, to waged daily laborers, and that's something which I was really appreciative, and I didn't expect that the government would do that much extra bit to do that. If you look at USA, they have about 1,100 per million cases. In India, there are only 5 cases per million, whereas in Italy there are 2,000 cases per million. And India is a land which is very small, and it's locked on all sides, and it has China, which is very near to India. And with such a huge population, which is the second largest populated country, or I don't know if it's already the if it's already the number one, and with such a huge population of 1 billion people, the number of cases per million is really low. And the close proximity which we talk about, and the social self-isolation which we talk about, the nationwide lockdown which we talk about, there are a lot of positives in India being a third world country. And the situation is not so bad as I think it to be when I look at things in this perspective. So that's what India is like right now. And when I'm talking about all these things, I feel like the next question which I could ask the two of you is like, do you want to talk a little bit about the strengths and weaknesses in your political system or in your culture, which affects the number of deaths or which affects the number of infected cases? One of you can go. Smia, would you like to go first?
Yeah. So it was interesting when Swati spoke about, and you also, about women leaders, who've had great results with their responses. But I think we can take it even broader. I think something that we've seen with COVID is that conservative leaders have responded pretty badly. If you look at the US, Donald Trump is a conservative leader. The UK, Boris Johnson is a conservative leader. At Brazil's president, who's conservative, they all started to respond very late in the epidemic, too late. And they also were most of them were in denial of how serious this virus is. Sort of pretended it's just like a flu, essentially, and didn't realize that there would be 20% of the people who would require hospital care, and that would put such a strain on your hospital system. So I think the advantage that South Africa has had was that our epidemic, our outbreak, started later than Europe and the US, and we could see what happens if you respond late. So I think, I do think our government was well prepared, but I think part of why we were extra well prepared is that we were almost scared into action because we saw what happened elsewhere, and we know very well that our health system doesn't come close to that of many European countries. And if they couldn't handle it, if a country like Italy couldn't handle it, what on earth would we do? So something our government has done well that it's never done well before. We come from a period where there was a lot of state capture in South Africa, a lot of corruption. So people really had a very low amount of confidence in the government. So it came as a big surprise when this response was so well organized. And I think what it has exposed is that, I think all epidemics is almost like a mirror of society. It shows you what is wrong. And what it's highlighted in South Africa is our inequality. We are one of the countries with the highest sort of gap between rich and poor, and if not the highest, essentially. And it shows you, for instance, the lockdown has a very different consequence based on where a person is coming from. It's also highlighted the parts of our health system that don't work well. So in South Africa, 15% of the population has access to health insurance. The rest rely on a very under-resourced public health system. And one of the things that has always been difficult in South Africa has been to get the private and the public sector to work together. There's always an issue of the government can't pay enough for the private sector, and the government sort of like from their side want cheaper services, so there's never a lot of cooperation. And just before COVID outbreak hit our country, pretty much the first part of this year, there's been a heavy debate in South Africa about universal access to healthcare. And the government came up with a plan called the National Health Insurance, which is very controversial, you could imagine, in a country like ours, and that suggested that medical insurance is done away with, because essentially the government would like to have access to the money that we pay for medical insurance and use it and go for a universal access healthcare system. So I think COVID has highlighted that gap. And the interesting thing that COVID has done is it has forced the private and public sector to work together in ways that it's never done before. One example is You know, it's very rare to have a private sector offer something for free to the public sector. It would always be at, at a price. And in many of our provinces, private hospitals have now offered free beds for COVID to the government. They would allow the government staff to come and work from the hospital, share machines, wouldn't charge them anything. And that has really never happened before. And the reason it is happening now is because everyone realizes that we're not going to get through this pandemic without, we don't have enough beds in the public sector, and everyone would suffer. And there's nothing that really protects you against COVID. It doesn't help to have money. It doesn't help to come from a certain gender. It doesn't help to be a high-powered leader. We've seen many leaders infected in the world. It is because we know we will all be affected. So I think in South Africa, one of the sort of nice consequences of the government responding early and everyone realizing that they will be affected is that groups that never worked together before have now come together. Another example is there's a lot of divided politics in South Africa, and all the opposition parties are on board. The same parties that is always against the government, that would, for instance, when we have a State of a Nation speech, prevent the president from speaking, essentially, because they're not happy with things, and sort of protesting in parliament, they are all on board. Now, I'm not saying there is no problems, there are obviously problems with people not having money, and in some parts, there's been crime, but essentially it has resulted in people starting to bring what they have on board. To give you another example, alcohol companies are very, very unhappy about the fact that there's an alcohol ban and they're losing money. But they have access to a lot of alcohol. So what they've done is to start to produce sanitizers, because we use alcohol-based sanitizers. And they're distributing it for free. It's also something that they wouldn't have done previously. And in that way, they're working with government in a way that they would never have worked with them before. Something that's hard, that I think is hard everywhere, is homeschooling your child. A 10-year-old daughter, and it's driving me through the roof. I'm a journalist, so I'm part of the essential workers. I work full-time. I've never been this busy. I work twice as hard as normally, but now I'm expected to get my child through school, and 20 children in a class having Zoom meetings each day. It's a little bit too much for me, and I feel, on a personal level, I fall behind with that. But I think essentially, if you ask what is that exposed political weaknesses, I think it has exposed in many countries what people have voted for, essentially. Consequences that you haven't felt so clearly as now. What is your feeling, Swati?
Thank you so much.
Yeah, that was such an eloquent expression of like the, things happening. I think what you say is relatable to a lot of the countries in the world, including the US. We have a conservative leader. Therefore, we also have several states that are run by conservative governors, and those are the few states that still continue to be open. I think I'll start with the strengths first with the US. I think we can all talk about a lot of the weaknesses of the way the US has handled this, but like you eloquently put it, it's a mirror. It sheds light onto what society has honestly voted for. And so in our system, while we may have more access for people towards healthcare, so a lot more people have healthcare access than perhaps in South Africa, it's still not the majority, which is unlike all the other wealthy nations. While Obamacare has been almost revoked, it's, the new administration is trying to make it a little bit more commercialized. A lot of people still don't have insurance. They don't have access to healthcare system. And a lot of the, people that are in the poverty, the poorest of the people, unfortunately live in close proximity to each other. And so in New York, which is our epicenter, most of the people afflicted with COVID are the ones that don't have insurance. But thankfully, no one can be turned away from our emergency room if they come in with or without insurance. And the government is actually doing lots of financial things to help not only the hospitals, but also all of the people that have lost their jobs. A lot of the businesses that are going out of business or are not able to function are all getting money, federal money from the government, which is probably, similar to India. It is something that I expected. I expected the government to help the people as, the economy starts going down. But they are also helping a lot more than I thought they would. So I think that's one strength. Is the other strength is, like you said, the private and the public sectors coming together. A lot of companies, even companies that did not, for example, make masks, are all ramping up their production of various kinds of masks. The people are trying to help by creating their own masks. But the negative part is that because our federal government does not have a strong foothold, states are bidding each other for ventilators and for supplies. So if there's, let's say New York needs 30,000 ventilators, they are bidding other states like California or Texas or Georgia for the same amount of ventilators, which I think is horrible that the states have to bid for this. And when this was discussed when this was brought up, the federal government said, well, the state should have been more prepared, which is crazy because the blame is being shifted. So those are the negative things. There's a lot of mixed messages, and that is, our people voted for who they voted for. And I would like to point out, though, that America's voting is a little bit different. Yes, the public votes, but then the presidential elections are run by an electoral college, which is decided upon by the people, but people are indirectly voting for the president. It's not a direct public vote. But with that being said, there's a lot of mixed messages. There's a lot of mistrust also of the media. I think that's why in certain conservative countries, they were in denial, because they truly did not believe the media and what the media was saying about this virus situation. I think one of the nicer things about people staying at home is that pollution has been cleared up. I used to live in LA, which is one of the most polluted cities in the country, in the United States. And it's not as polluted as China or India, but it's, you often see the smog over the horizon and the ocean, and that is clearing. And I think it's the air quality has improved quite a bit. And I think people actually appreciate that. I think even in India, Purnima, you can attest to this. People are finally seeing the Himalayan mountains, like the landscape, which they haven't seen in decades.
Yeah.
So I think that's one of the nicer perks. For me personally, I think it's been the most stressful time I've ever encountered in my life. And I went through med school, I went through residency, I took a bunch of exams. So none of those times compare to the situation we're facing now. As a healthcare provider, my safety has been at risk because of inadequate preparation. And that has definitely been one of the biggest weaknesses in the US. I am not even what we call a frontline healthcare worker. I don't directly intubate and put patients on ventilators, but I do surgeries around the noses and the lips, and there's a lot of what we call aerosolization of particles. That means that when we're doing surgeries, we're stopping the bleeding with an instrument that kind of burns the area a little bit. Whenever you burn, you aerosolize or put these particles into the air, and I don't have adequate protection to protect myself from inhaling all of that air. So I'm also at risk of COVID, especially because there's a lot of asymptomatic carriage, as we know. A lot of people don't even present with symptoms until day 9 or day 10 if they're infected with COVID. So while we have screening protocols in place, those screening protocols are not very accurate because of the high rate of asymptomatic carriage. So healthcare workers, are working with adequate protection. A lot of them are stranded from their self-isolating from their families. The administration in some hospitals has not been very supportive at all. So for example, when hospital workers speak out against the proper protection, the administration is saying, you will be fired if you continue speaking out. Or they have actually fired nurses and doctors for speaking out and telling the media about the lack of protective equipment. So I think I've said this so many times. When I signed up to be a doctor, I never once signed up to become a martyr. And it's now the doctors, especially in the US and even in countries like Italy, Spain, that did not have enough protective equipment, it's like sending soldiers into a war without guns, right? So that, I think that has been one of the biggest weaknesses, is inadequate protection of physicians. We're not soldiers. We are physicians, and we are nurses and medical assistants and technicians, and we are being told to work in situations that put our health at a much higher risk than it should be. I think a lot of changes will happen moving forward. I hope that doctors and physicians and nurses moving forward will fight for their protection, instead of being, quieted down by admin. I don't know how it is in other countries, but in India or in the US, I mean, a lot of hospitals are run by people who are not doctors. And so that causes a lot of issues, because there's one side that's, looking out for finance and money, which is important, but then, they're not seeing patients. And then you have doctors who are seeing patients who are told to do things that, really they should not be being, they should not have to do. So I'll leave it there. You can probably tell by my tone that I'm kind of, passionate about this and irked by it, because it affects me and my friends so much. But that is, I think, the biggest problem with this situation, is the lack of preparation because of mistrust and denial, which is a society problem also.
Thank you, Swati. Um, it was it's a difficult thing to listen to, I understand, and my heart is with you and your friends, and I hope you all stay safe. And I can't say stay home and stay safe, but I hope to say
Thanks,
stay
Purnima.
safe. Yeah. And
Yeah, thank you.
it's really a very stressful situation if you look at it that way. I mean, there is no other way to look at it. It is a stressful situation. But coming back to the question, like which I asked you earlier about the political situation in India, it has been reasonably good. The current government can actually bring India out of this crisis relatively less affected than the West, is my feeling, looking at the media report of the media, and looking at how things are going up here. And India is emerging even stronger. In my state, Tamil Nadu state, in the news, it was declared that the curve is almost flattened, and probably we can even open the lockdown with the approval of the center. That was something which was discussed. Of course, it won't be, things are not going to be as normal as it sounds like. And this current government has always done its best, and it looks very resilient. I'm not sharing my support of which government I support, but so far things are good and it's positive. That's one thing about the strength of this government. Yes, there are definitely a lot of weaknesses, like the suicide rate has increased in India. While we are taking care of our physical health, there are a lot of mental health challenges which we have to rise up to. India's suicide rates have gone up very drastically. So that's certainly a weakness. And I'm not a hardcore journalist, so I can't comment so much about that. But looking at the news, reading newspapers, we certainly look at that. When I look at the culture of India, that is also slightly difficult because women still have a bigger, larger role to play in Indian society, which is very invisible. It's very, very invisible. It's not even something I can think of and put words into. But Indian women have also been very resilient, as you say, as you've seen, and I mean, all global women as a whole have been a very resilient part of the species. And like you pointed out earlier in the conversation, countries who have had women leaders have handled this much better, and they have risen to the occasion very beautifully. So that's something which I really admire. And I'm not expressing my displeasure. I'm not expressing my uh, disappointment about it. I'm rather feeling grateful to God that this opportunity has come, which has helped us all put our abilities into a very positive light. And crisis is always an opportunity if you want to look at it that way. And adding to what Mia said a bit earlier, she mentioned how the government has been really good and helpful. I remember a news item which came on March 23rd. uh, the UN Secretary General Antonio Guterres made an unprecedented appeal for an immediate global ceasefire to facilitate humanitarian access. I'm reading from the website, by the way. For an immediate global ceasefire to facilitate humanitarian access to the populations most vulnerable to stop the spread of the novel coronavirus. This was the first global ceasefire request in the 75-year history of the United Nations. So this was something I was really blown away by. Like if the world world political system comes together and fights this in such a beautiful way, if that is going to actually happen, then well, that's really a very positive thing. The new normal is going to be really great. Of course, we are all suffering a lot now, but I am really hopeful for the new normal, and probably all the weaknesses which has come out is going to be converted into positives, is my hope. So that's what I would like to share uh, for this question, and which leads me to my next question to Mia. How can media shed a positive light on what is happening? How can media be truthful in what it's sharing? Mia, you're a journalist, and I think you can like talk more about this, because there are also instances when the media hypes certain things, and the media has been blamed for those type of things. But you being a media person and interacting with us directly, could you help us, could you talk about it a little bit?
So I am not sure that, we should say the media should have positive stories necessarily, because it's a very difficult situation that we are in. So maybe redefine positive, meaningful stories that can, with information that people can use, essentially, that empowers them. So I think one of the, a simple way in South Africa would be, to highlight, positive actions from the government. For instance, we don't have the kind of money that the US has to give people checks, and India has to, who lost their business. We only have 15% in the country that pays taxes. So you could imagine that taxes need to do a lot of work. The rest of the country simply don't earn enough to pay taxes. So on the day when we especially had a 3-week lockdown, and then it got extended with another 2 weeks. And on the day that the president announced that he was going to extend it, he also made an announcement to say that he is taking a third cut in his salary, and has instructed all his cabinet ministers to cut their salaries by a third. And South Africa has a fund which is called the Solidarity Fund to pay in money for people who don't have money, and they're paying a third of their salaries in there for the next 3 months. Now, I think that was quite commendable. So that would be something that would be worth highlighting, because it could also inspire other wealthy people to take a third of their salaries. But in terms of constructive coverage, at Bekasisa, we do something called solutions journalism. And that's not a story, it's really not a story that lists 5 solutions at the end. It's a story that looks, that evaluates a solution to a problem and see what works and what doesn't. And there's a lot of research that shows that if you do those type of stories, people engage a lot longer with the story. So they read the story further than they would read another story, and they're also more likely to click on the headline. So stories that we can do in COVID, a type of story like that would be lessons from other countries. And in this case, there are so many lessons to learn. Everyone can learn from South Korea on when to start testing and how many people to test today and what is the effect of that. We can learn bad lessons too. We can see, for instance, what happened in Italy when you start when you respond too late in the epidemic. I think that's very meaningful information for countries if the media do stories on that. And I think the media has done stories. I've seen a lot of New York Times, Washington Post stories on it, here at Bikisisa we've done it as well. And another example of lessons that you can learn in South Africa, I have done a story on comparing our COVID response to our HIV response, because our HIV response was essentially based on quack science initially. The government doubted the cause, the link between HIV and AIDS, and as a result, thought treatment was poisonous and did not make it available. And I compared the consequences of that with the consequences of what we're doing now. And that has been, I think, useful, because people can see really what is that we learning. History has been our lesson, and that we're using those lessons to improve our response. I think other examples could be to also highlight inequality. So I mentioned that we had our discussion for national health insurance, before COVID, and no one wants to work together. And I'm hoping that COVID could potentially bridge some of those gaps, just because it's such a desperate situation, and that it would break down barriers that would make it easier for people to work together to achieve universal access to healthcare. And if the media covers that in a meaningful way and sort of like provides lessons of what you can learn from the situation, that's at least advice that you can sort of follow. And it would also empower the government and what to do. The other thing that I think, it's that you can almost brand as really important, I don't know if it's positive, but, the positive side of it would be that when you report on an epidemic like this, especially something that is so infectious and that is, could have such a devastating effect, if you don't report on the correct science, it literally leads to deaths. It is literally the difference between life and death. So when it comes to myths, and when it comes to inaccurate information that was not willfully inaccurate, but that you did not check with a scientist, especially if you're, for instance, not a health journalist and you're not used to working with scientists, it is really important to get it right. So I think we can learn from COVID what is the value of having correct information. I can give you an example in South Africa. When we did our first COVID story, we interviewed quite a senior member of our COVID team. And now I've told you we have an evidence-based response, but now listen to what this person did. And she told us that, there's really we don't have to worry that COVID would spread so fast in South Africa because it's summer. And the weather would prevent it from spreading because COVID doesn't like a warm environment. We reported what she said and got taken on social media by scientists because this is not true. There is no conclusive evidence that shows you that the weather would prevent the virus from spreading. And we had to correct that story because we then started reading the studies and saw it was incorrect. Now, that is harmful information. That is giving people a false sense of security. And it wasn't just us, it was, the person who gave us that information was in a powerful position. It's not just the media that needs to be accurate, it's scientists that need to be accurate as well, and politicians that need to be accurate. I mean, Donald Trump, promoted chloroquine, for which there's no evidence that it works. So I really think, and in South Africa, we've also had a chloroquine issue with a union, a workers' union promoting it. So in those cases, I think it is so important for the media to be constructive and not just say it's wrong, to explain why is it wrong and to break down the science. We have a situation, and I think the media has helped to clear it up, where many doctors started to prescribe chloroquine in South Africa, and we have a lot of people with arthritis and lupus, and they couldn't get hold of their medication because they use chloroquine for to treat those conditions. And it really led to some people not having access to their medication, where they give it to people where there's no proof that it works. And the media did very critical reports on that, and I get the impression that has gone down a bit. It's not as prominent in the media any longer. So we can really also have an effect on changing behavior and encouraging people to do the right things. For instance, in South Africa, we now have a recommendation to wear cloth masks. We know there's no evidence that shows that a cloth mask would prevent you from contracting the virus, but that it would prevent other people from contracting it if you have it. And it's very important to explain that science so that people don't think they are protected and don't have to wash their hands or don't have to do social distancing. But we also live in a country where the majority of the country can't practice social distancing because they live in such overcrowded conditions and they use public transport that it's just not possible. And the argument is that in those environments, a cloth mask would be really useful because the accumulative effect of everyone wearing it would be good. And the media can play a role in breaking down that science. So what we've tried to do is when we explain those things, we try and make videos because it's accessible to a broader part of the population. You don't necessarily need to be able to read difficult things. And where our audience normally is a decision maker audience, our audience has now become much broader because people are so desperate for the information. So I think the way in which we present information in the media is also very important here, and we need to adjust and think about really what people need and not just do what we normally do. That's about it.
Swati, would you like to add to it from the US perspective or from any perspective?
Well, Mia, that was very thorough, Mia. I agree with a lot of I agree with everything you said. In the US, unfortunately, I do not believe that our media is very constructive. There's been a lot of fake news propaganda that was initiated by the last presidential election, and that has played a big role in a lot of the denial that our society has had. I completely agree with accurate representation of facts. Our own CDC, so our American CDC implemented guidelines that were not accurate. So they told people to wear normal, or hospital care workers, that normal masks would be protective when there's enough evidence to show that COVID is not only spread by respiratory droplets, but it's also aerosolized. That means like breathing and talking to somebody can spread this virus, which a normal face mask does not protect against. So there's been, and those guidelines were then unfortunately implemented into the hospitals, and people were wearing normal masks when they should have been wearing N95 masks. Of course, those guidelines were implemented because we did not have enough N95 masks, but the public should not be told to do something because there's a lack of supply. They should be told hey, this is what we need to do, but if we don't have this, then we should do this. And that's not what was done at all in the US. And I hope that moving forward, this really teaches a lot of us, including, the media and everyone, and scientists, to be accurate. And if we do not have enough data, to actually say that, not in fine print at the bottom of the website, but in bold letters, to say we do not have enough data. However, we have it. We have seen it that this may help or this may not help. So. I'll leave it at that for that question.
Thank you, Dr. Swati, and thank you, Mia. Your response was thoroughly adequate, and thank you, Swati, for adding to it too. Yeah, and there were news items, and I don't want to even call it news items. There are rumors that certain vaccines can prevent COVID-19, and I don't think that's either proven, right? Yeah, so I totally agree as to the care these people should take to share information. So in relation to that, I think Mia has covered a lot of ground, but do you think there are any partnerships which the media could undertake between the government and the scientists and so on? I know a lot of ground has been covered, but if there's something Mia can add about the aspect of partnerships, I would love to hear that.
Yes. So, for me, who was a journalist who reported on HIV when our government basically had a denialist response, and we were the enemy of the government. Activists and journalists who supported science were really the enemy. It's a very strange experience to report on COVID-19 in South Africa because the media has been called partners on several occasions by the health minister. And it's still a little bit hard for me to believe that because I'm not used to that kind of environment. So I think South Africa is a good example of where a partnership between the media and the government has really paid off. Because what does it mean? It doesn't mean that we don't report critically on government. You know, we have been reporting on when they were slow with testing, there was a lot of pressure on testing. We have the police and army patrolling our streets to keep people in their houses and they're misbehaving. We report on that, they abuse their power. But essentially, we've played a very, very integral part in distributing information. And by that, I don't just mean announcing the new number of cases each day. We have a state of disaster that's been declared, and the lockdown is a result of that. But there's a lot of rules around this. For instance, when the state of disaster was declared, all the ministers would then have a press conference, and the Minister of Transport would talk about what would happen to public transport, when is it allowed to operate, when not. The Education Minister will talk about schools. And each department would have something to say, and they would all have to gazette this, and it's a lot of information to get to people. So the media was very instrumental in distributing the rules of what you're allowed to do, what you're not allowed to do, and to go further on that, to help the government to monitor that it's implemented, because we go on the streets, and if the police misbehaved, we report on that, and they get taken on. So there were partnerships definitely that's been built with regards to that. But there's another interesting partnership that has developed because the government has been embracing science. It started to develop a very, very strong relationship with scientists. And you know, last Sunday in South Africa, we had there was a Zoom call that 500 people, anyone in the country could join, but the same call was broadcast live on 3 or 4 television stations. And it was interesting, and it was essentially the government explaining this, how they use science to make decisions. Now, the important thing that they did here is they let the scientists talk. They didn't talk. So the health minister allowed the guy who heads up the ministerial committee of the scientist who's the chair of the committee that advises the president to explain what they do. You know, imagine having a nation and a scientist who's very good. This particular scientist was very, very good with breaking down it into easy language, explaining to the country how we know when this pandemic is going to peak. So that nation knows that if we have a 3-week lockdown, our epidemic will peak in July. However, if we stick it out for the next 2 weeks, our projections show it will only peak in September, and we have more time to prepare, and it will also peak in a more, flatten the curve sort of way. There will not be as many cases at once. Imagine a nation understanding that. It empowers you because you know why you need to stay in your house. There was that scientist explained to us literally what information they will use to decide whether this lockdown continues or whether it ends. And he explained they've worked out that if we have more than an average of 90 infections a day in the past week, then we would have to extend it, because it means then that the rate of infection is not slowing down. And that again empowers you to stay at home. But he also explained that, can we escape, what's coming, because the worst part is still coming? And he explained, no, we can't. It doesn't matter that we've had a lockdown. You can't escape what this virus is going to do to your country, but you can play a role in how it plays out. You can make it spread at a slower rate and give yourself more time to prepare. And that the country then understood as well, which means that when we get to our worst part, people are less likely to say, oh, the government didn't do its job, because we told you ahead of time, this is coming. So that partnership and that way of communication was almost like a media role, to have a government put a scientist on national TV that tells people why they need to do stuff. is almost like fulfilling the role of the media, because it's a mass broadcast. You know, you almost don't need the media to then tell the information. But you know what we did at Pekasisa then as a partnership is, this guy explained it so well that we took snippets, the interesting bits of the speech, 2-minute podcasts, and he had slides that everyone liked. And we took their presentation and we put the little soundbite behind it and break it up. For instance, say, this sort of like, has our lockdown worked or not? And here he explains it. Or would our lockdown be extended? Then he explains it. And it's amazing how people, you know, we can see the figures online, who watched it and who, you know, who didn't listen to it or who did, and how it was taken up on social media. So that was a partnership that, you know, they didn't ask us to do this, but this guy was so good that we felt it would be a very good thing for us to also do. And as a result of that, what has happened? This guy's name is Salim Abdul Karim. He has been the guest in 2 webinars of 2 media organizations. And we're having a webinar on Monday, you know, where him and his wife is as clever, you know, are going to explain stuff to people. And, you know, we started advertising that webinar yesterday, and we already have 200 people who've signed up, which is, in South Africa, that's a relatively small country. You know, that's a lot of, you know, we can only host 500 people and on the kind of Zoom account that we have. So I think there's a lot of spin-off if there is a solid response, and then partnerships comes with fewer barriers, and it's easier to have them and to have them sort of develop in a spontaneous way without a situation where you have to beg for someone to work with you.
Wow, that was very encouraging to listen to, Mia. That was very hopeful and encouraging to listen to. And thank you so much for sharing that with all of us. That's really a very interesting thing all nations could possibly do. And it is really good that you are telling it out loud in this international webinar. So along the same lines, where you're speaking about facts and truths, you know, like my next question is going to be to Swati. How can we turn this situation where we are presented with all the facts very accurately, and facts actually share a gloom and doom situation at times, if you want to look at it that way. But how can you, is there a way to turn the whole thing into a positive scenario, if you will? Or is this, how can we use this opportunity to prepare ourselves better for a new normal? How can we use this opportunity to bring out the best in ourselves?
Thank you, Purnima, and thank you, Mia. Well, I think every cloud has a silver lining. So that is a saying, you know, for a reason, that in any bad situation, we can try to make the best of it. Obviously, if financially you're suffering from hardships, or you're, you know, currently if you're suffering from not having enough food, then it's hard to focus on the positive. And obviously at that time, prayers and positive thinking may not do much. At that time, when you need to bring food on the table, you have to act. So I think I don't want to focus this question towards the people that have to act, but I will answer this question for the people who have the privilege of being at home, who are not suffering from too much economic or financial hardship, and who can somehow, you know, who can benefit from social distancing. So how do we benefit at a time like this? You know, a lot of us, unfortunately, for example, in the US, the sales for alcohol have completely risen, which there was an April Fool's joke that the governor shut down alcohol stores because that's how much the alcohol sales have risen, that people would be horrified if the alcohol stores were shut down. And I think that's because a lot of people are turning towards alcohol, food, and substance use during these times because of increased levels of anxiety. Now, if you have that anxiety just because you're restless at home, I think there are other ways of relaxing. You know, we can go for walks, we can exercise, we can, you know, use this as a time to learn and grow. We can learn a new language, learn how to play an instrument, etc. One of the other things, obviously, is also what this Heartfulness Institute does, which is meditation. I think it's a really great time for humanity to learn to meditate. Now, again, I really want to clarify that meditation is not going to bring food on the table. That only a person can do. But for all of us that are suffering from increased levels of stress and anxiety, a few minutes of meditation in a day can really go a long way. And I think meditation as a whole, just in terms of humanity in general, would really raise the level of clarity within humanity. So if you can imagine, if people were able to meditate, you in turn would be able to introspect more, and then you're more able to believe any sort of, or not believe, but act upon any sort of accurate information that you stumble upon. So if people had more clarity, perhaps all the countries would have reacted in a way to save the maximum number of lives without overburdening the healthcare systems. So meditation not only has personal benefits, which I'm sure everybody now has heard of, but it also has community benefits. It has, worldwide benefits. Yeah, I was trying to think of what else I can add to that. In my own personal life, I can't say that meditation has helped me every single time I have meditated, but similar to exercise, there has never been a meditation or exercise that I have regretted. When a lot of times we don't even want to exercise, but then when we finally do it, we're very happy we did it. And I think that's the same thing for anything like meditation or anything related to self-care. So yes, as I was saying, I personally have benefited a lot, but I think it's very difficult to go inwards sometimes when you're so stressed. So I think some techniques, perhaps just outside of meditation, include, breathing techniques, distracting yourself, especially if you are very stressed or anxious, just to distract yourself with learning a new habit or taking, painting, drawing, doing anything that kind of relaxes you. And also enriches your mind. I think a lot of us are just kind of glued to our TV watching a lot of news. I know I am in the US. And while that is, very helpful to learn about what's happening with the current situation, I think it can also breed some amounts of anxiety. So it's important to then learn to either do something else that creates positivity in your life, or to help others, which can also obviously, include some positivity. And I think that's what I would like to conclude with. I think in these times, while other people are, maybe suffering, we can take it upon ourselves, if we have the privilege of, being a little bit more economically and financially free, to help, others in need. There are a lot of people in my community who are doing food drives and whatnot to help the homeless and other people who do not have access to food. People are donating, foods for the elderly who do not have the ability to go to the grocery stores themselves. So there's lots of ways I think that other people can help and reach out. And I think it's important for all of us to kind of see how we can help those who need help. And kind of go from there. I think media also in South Africa, it seems like they have been really good at accurately reporting and exposing the current situation for whatever it is. And I think it's moving forward. It's important, yes, to focus on the positive, but to not neglect the reality of the situation. We shouldn't condone the negative just because we're so focused on the positive. We want to, look at the dark cloud and the silver lining together at one horizon. So I will conclude my message with that.
Thank you, Swati. Thank you so much. That was a beautiful thing to say. And I was just reminded of this word crisis, which has a root word in Greek language. And what it actually means in the Greek language is that crisis is that point in time when a disease is just turning around to mellow down, or probably it's just that turning point when the solution or the cure or the getting all right phase is about to begin. So the meaning in Greek is that. And as we are going through this crisis, quote unquote crisis, like you said, I also agree with the fact that it's important to look back and look forward and try to take stock of everything and try to emerge stronger. And it is a very important step for us to help those in need. It's just not looking at the negatives and positives, but trying to act in a willfully conscious way to show that as a species we are capable of taking care of all of us in a collective way. So I like that message, and I also think leaving us all with that message is wonderful. If Mia, do you have any closing thoughts? I would really appreciate you to share your closing thoughts too.
Maybe just to support what Swati said, we published a piece. We specialize in evidence-based journalism, so we include a lot of studies in our stories. And this specific piece focused on, it was from a psychologist, on what can you do during times like this to get through it. And it emerged from evidence, and Swati has mentioned it, that one of the most helpful things during a time of crisis that makes life meaningful for you again is to help someone else, to do something meaningful for another person. That actually almost has a bigger effect on you than the person that you're helping. It's as beneficial to you as the person that you're helping. And that is perhaps it's something that we should really think about during this time. And there's so many opportunities to make ourselves useful. There's so many times that we can do something meaningful and where it can also be beneficial to ourselves because we've played a role in making life meaningful in general.
Yes, beautifully said.
Thank you, Mia. Thank you so much. And thank you so much, Swati, for everything that both of you said. I mean, I don't have any specific words. This has come out really beautiful. And as I promised the viewers, this is just a chat between the three of us from three different countries to share just what's been happening in the background and also to share a ray of hope with you all. And on behalf of the Heartfulness Institute, I recommend that all of you try the Heartfulness relaxation and meditation techniques. The link for that will be left in the comments below. If you have any questions to any of the speakers, to Dr. Swati Kannan or to Mia Malan from South Africa, you can leave them also as comments in this webinar, in this video, in the comment section. Thank you so much once again to Dr. Swati, to Mia Malan, and to all the viewers for tuning in, listening to us today. Goodbye.